Hello, everybody. It's a day before that time of the week. We're doing this on Thursday because it's more relevant to do it today. I haven't had a chance to have a shave today or go for my run. We've been totally overwhelmed by two words: contact tracing. Sounds great. It has been so badly thought out. It's shocking, and it's causing us potentially masses of problems. And it's taking up all of our time trying to work it all out. So what we decided was we went into it in a lot of detail today in the Cobra meeting, which we're not going to call a Cobra meeting. We're going to call it my weekly update, because I think it explains what we're planning to do and so on. And first of all, the reassurance is we will sort this out. Whatever happens, we will do, and we will take things into our own hands in order to ensure absolutely the safety, my daughter, your sons and daughters, and so on. We will not allow a really bad, potentially legally binding decision which could absolutely threaten our sons and daughters' well-being. We will not allow that to happen. So we're having to play this very carefully with legal advice and so on. This is not easy, and this is complex. So rather than sort of say anything more, I can tell you that it's been a fantastic week, other than this particular problem. We've more or less sorted out PPE, I believe, with PHE, Public Health England. That was all great, but it has opened this can of worms around contact tracing. So I'm going to let the film just take over, and a recording of our meeting earlier on, to let you know what's happening. And in the meantime, just really wish you all, have a great weekend, and may the weather be great, and stay with us, and stay safe. Thanks.
Okay, so let's just be clear. Under this new contact and test, or test and contact, what the hell it's called. Okay, we've now got one member of staff, who is suspected. Okay, as I understand it, under the guidance now, we should be identifying the number of staff that actually have been in contact with that member of staff. Okay,
absolutely.
We know in this case that it's 14 members of staff from one home. Okay, and under this new contact thing, we would then be required to make all of those people self-isolate.
If the test comes back positive.
Not at the moment, unless she's positive. So I think reading the guidance, so Temi this morning sent through all the people she would have been in contact with for the last 48 hours. Reading the guidance, I believe we should be informing them that we have a suspected case. However, the guidance is more about how they should be socially distancing much more and being much more precautious. And then when we get the test results, we then inform them what that result is. If that comes back as positive, that group of staff, if she's been in direct contact with them, would have to then self-isolate. But as it stands at the moment, they don't need to self-isolate.
Okay, right. Okay, no, that's great. So if she now came back, or this member of staff came back positive, we would now have to send home 14 members of staff, which is approximately 50% of our staff in a home with very complex individuals. And at that stage, we don't have a viable service, because we would not, under normal circumstances, be able to backfill 14 members of staff who are 40 or 50% of the home. Yeah. That's what we're saying, isn't it?
Yeah, potentially, if she's been in direct contact with those staff, unless she's been in a bubble, as we've discussed, if she's worked directly with an individual, but she would need to contact them, wouldn't she, and identify the people that she has been in contact with.
Okay, so to some extent you could mitigate it, but only to some extent.
Yeah.
And equally, if this happened to be a member of staff who was cohabiting with another member of staff, which is what we have in a lot of cases, who's working in a different service, then that would actually have the same effect if they both tested positive on. Well, anyway, it's mind-boggling. Yeah, I mean, it's mind-bogglingly stupid. Okay, so what we're doing is, so we're coming up with a process which we're looking at, where those member of staff, because we couldn't afford to lose them, where we could actually protect them through wearing PPE, etc. So, as an alternative, although we would essentially be breaking the rules or the law or whatever this thing's called, but then we'd have no choice, because the choice is to put something in that's effective, that stops members of staff infecting people by putting them into PPE, etc., and having a really coherent plan, and doing that and being able to support individuals, or not having any staff to support individuals. And then what do we do with the individuals? Okay, now tell me something else. If by chance one of our individuals got tested positive, right, for COVID-19, okay, within a home, okay, and let us assume it's one of our homes where people intermingle more, right? Now you've now then got a situation where an individual tests positive, which presumably would have come in through staff. So now they've commingled with all of the individuals within that home and with most of the staff in that home. Yeah. Okay, I'm lost at this stage. Yeah. What the hell do you do in that situation?
Absolutely, it's not clear. You know, all of our staff are wearing PPE at the moment. So does that mitigate the need to self-isolate? We don't know. That's not obvious. But what we are doing is putting a plan together as to how we could create an isolation bubble, but allow those staff to continue to work.
Yeah, but what's going to happen is that the countermeasures that you need to put in then get to such an extreme stage, you know, and they become stupid in a way where you start to break down the home into different sections and God knows what. You now then completely destroy the interaction between the individuals, and we know what's going to happen then.
Yeah, it's not a long term, it's not sustainable in the long term.
No, and yet this is likely to be a long-term problem because we're into sort of an insurgency stage now where it's going to pop up and pop down. And the way you sort out an insurgency, as we said before, is you sit down and you talk to the tribal chiefs and you work out locally how you're going to deal with this. Well, I can tell you there is no local mechanism to do this. This is my complete understanding from talking to Public Health England. Everything is being dictated from the bloody top. So there is no local structure for this. Yeah, this is a recipe for morons.
I think that there may be some good news in the sense that it says that if you haven't been contacted by NHS Test and Trace Service, then you're not required to isolate. So trying to establish for yourself whether you think you've been in contact with somebody, it very clearly says if you think you've been in contact with somebody but you've not been contacted by NHS, then you don't need to isolate. The second thing that helps us is that any sectors like health or care settings, for example, care homes, will be escalated to local health and protection teams. So we will potentially have a local solution. So we could discuss with them our plan and what it would mean for us, rather than it being the national test and trace.
But I would rather have that discussion now.
Yes, and we've got to force that discussion now. Yeah, so we come up with our plan, which we're working on right at the moment. So that'll be finished for tomorrow. We'll implement it over the weekend. We'll start implementing as a matter of urgency, and we will tell everybody that it's completely impossible to, you know, we'll make our statement, you know, that it's impossible to action what is being said.
But we'll continue with our plan. I think that's.
Oh yeah, we're going to
implement.
We're going to implement our plan. And I'm going to tell you now, if the choice is that we have to break the law because we've got to protect the individuals, then I'm telling you now, we're going to bloody well break the law if that's what the case is, providing that we are covering off everything that we should be doing, you know, and that we're taking all the countermeasures that are there, because it's a very tight choice. Yeah. Do you protect a vulnerable person, you know, at the expense of having to break some sort of stupidly badly thought out regulation? And there's only one answer to that. You have to do morally what's right. Yeah, and screw it. Yeah, and you know, Mel, you have to sort of check whatever we've got to do. I think where we've got to write letters to people and saying you've got an unworkable system, we're putting you on notice that we will break the law around your rules. Mel, are you there?
Yeah. Yes, you're right, Paul. But I think, you know, we mustn't lose sight. We have to plan for the worst case scenario and put in place the practices we need to adopt. The guidance at the moment is not complete. The definition of close contact does not include anyone who's been wearing PPE. It's just not all there. So my assessment is that there will be another set of guidance, excuse me, that comes out hopefully sooner rather than later today, that deals with it in a health and social care setting, because a hospital can't function on this basis.
Yeah. Okay, but I think we need to be ready to go out. So we're going to put in plan. We're going to build our plan now. We should have it completed by tomorrow afternoon. If we're all happy on it, we sign off on it. And then I think we need to say that this is such a mess in advance of getting, a proper response to all of this. I think we should inform, I would suggest, all of our commissioners and the local authority, Lincolnshire and so on, and saying that, in the event that this is unclear still, this is the plan that we're implementing, because we're not prepared to put individuals at risk, because there's no logical way that you could actually move an individual, protect an individual other than by giving them support through people who potentially you've got to furlough, you've got to work at home.
I think we need to focus a little bit on communicating with the staff, because the guidance as it's been issued so far is unclear. And I think we need to give them an indication of how we will support them, and then what we expect of them, and how we can all support one another to get through this and support the individuals. I think that's really important.
The problem, though, is, from what I see, is it's actually, we could say we're going to break the law or do whatever we're going to do, but the onus is on the staff, isn't it? It's their responsibility. So, I mean,
they have a decision to make. If they test positive and the NHS tracers contact them and say, who have you been in contact with? It's up to them who they reference, but maybe we need to do a little bit of work with the staff around that, because they may be nervous about saying who they were with for all sorts of reasons.
Absolutely. I was talking to Alan this morning, and he says, this is totally perverse. This is a stupid idea, this whole thing, because it's going to stop people going to get a test. Full stop. They're just not going to want to go and get a test when they understand this. It's unworkable. And sorry, when I talk about breaking the law, I'm just saying that at the end of the day, our responsibility lies, at the bottom line, when in a stupid situation, our responsibility lies around the welfare of the individuals we support. We also have to take into account, as Hugo says, the legal aspects of staff or whatever. But any staff who supports our aim on this, we will support them 100%, obviously, because we need their sort of cooperation. But, we can't have a situation where individuals' well-being to such an extent is being put at risk by a Muppet situation.
The problem is, I think this stuff is sort of brought over from sort of South Korea, China. Their democracy, their society is very different, isn't it? It's very cut and dry, and for it needs to be tailored for this sort of the way we live here.
I also think we need to think of the homes as a household. We are in that hybrid place, and so if we look at the strict wording of the guidance as it stands at the moment, if I test positive, then although I have at that point my family obviously have to isolate with me, but if I'm just somebody named as a close contact of somebody who is tested positive, the rest of my household can go about their daily life as normal, going to work, going to school, etc., etc. And it's only if I develop symptoms that whole track and trace thing then effectively comes into being for me. So I think that is where it may be nuanced in the health and social care sector to enable the sectors to continue to work, but we just don't know how.
The thing at the moment as it stands is that it's not mandated, is it, for people to self-isolate at this point? That might change, but at the moment it's persuasiveness rather than it's a legal requirement. So
that's helpful, because we'll persuade them not to self-isolate.
Absolutely. Matt Hancock was on Sky this morning talking about it being people's civil duty. Well, we'd say it's people's civil duty to make sure that the services continue. So
yes.
That's a really weak phrase, civil duty. I think it's dangerous because it can be interpreted in all sorts of different ways, and I think it will get given weight depending on how this works.
Yeah.
And it will be adverse weight from our perspective, I'm sure.
Yeah. But we'll have a tangible plan, and I think that's our best option.
But I think it's more than a tangible plan, Joe, Hugo. I think we just implement it, full stop. Yeah, let's just go ahead and implement it.